Hello.
Good morning.
Saying hello to everyone. Hello.
Hello.
Hello, everyone. It's so good to see you all coming in.
The whole
Lucy,
world is running.
Lucy, can you check how many? Oh, we have 48 participants already. Okay, so we'll start in 30 seconds.
Yep.
Okay, let's start, I guess. Good morning, everyone. Thanks for joining. We are really excited with Lucy to have the opportunity to talk to you today. We will have the first hour as a online course on solutions journalism and how to apply it to the COVID-19 coverage. I am going to present myself and then Lucy's going to do so. I'm Nina Facio. I'm the manager in Europe for the Solutions Journalism Network for almost 4 years now. And I think that's the first time we do a webinar together, Lucy. Do you want to introduce yourself?
Yes, good morning, everyone. I'm Lucy. I am the head of Solutions Journalism Program in CE at Transitions, based in Prague. And this is my very first webinar being the presenter, not just the viewer. So please bear with us. This is our first time, but we are very happy to have so many people here. I'm here with my two colleagues from Transitions as well. Jeremy Drucker, who is the director of Transitions actually, and editor-in-chief of our wonderful magazine, and Kai Krauthammer, Solutions Journalism editor of our magazine, and they will be managing the questions in the chat, because this is the only way in this webinar how you can interact with us, and we would like to encourage you to do so as much as possible. So ask your questions, post your comments.
Yeah, we'll take some time to take your questions, but please send them along the way. And thanks, Jeremy and Kai, for being with us.
Thank you.
Sure. Thanks for doing this.
And then we'll be joined after an hour of online course by Rice-Oxley from The Guardian, who is managing the column called The Upside. So let's go. If you can first put in the chat, and please choose the option to send to all panelists and attendees so that everyone can see your questions. What are you hoping to get out of this webinar today? And so we'll try to adapt and maybe spend more time on things that you might be expecting. Also, we wanted to let you know that this webinar is recorded, and we'll make it available on YouTube afterwards. So if you want to share it or look at it again. Our goal for today's learning goal for today are first define what is solutions journalism and what are the 4 criteria that we apply to it, and then look at examples using the 4 pillars of solution stories on COVID-19. and discuss the strategies for applying these principles to covering COVID-19 coverage. And I think that's a great opportunity that we have Mark joining, because he's going to be able to talk about this as well. I realize I forgot to mention that I'm not Julia Holtz, but you all, I think you received my email yesterday. I'm using her account. She's my colleague at SGN, and I'm using her account because it's licensed for webinars. Lucy, do you want to, or maybe we can take some time now to look at some of the hopes that were brought in the chats?
Yes, and also guys, please throw your country, where are you joining from, so that we have kind of a feeling of where are you from and what
who is with us.
Who is with us and how the map looks. Actually, we are very curious about this. Thanks.
Yeah. We had more than 160 people registered, and it was pretty diverse from what I saw, but if you want to drop your country in the chat, you're welcome. So Kai, Jeremy, is there any particular hopes?
Hi, yeah, we have an interesting question here from, not sure who it's from. Someone wants to know about reporting in a cross-continental context. How can I do Europe-African reporting that is relevant to publications on both continents? That's a really good question, because there's so many different approaches to this pandemic, and we haven't heard much about what's going on in Africa.
Yeah, well, yes, that's a really good point. And while I'm the only staff member from the Solutions Journalism Network that is outside of the US, so being inclusive about different types of audience and cross-continent and cross-countries is something that I really try to keep in mind all the time when I do trainings. And I think there is multiple aspects to it. So first of all, how to report remotely, how to report from home when you're far away from maybe the response and the solutions that you're looking into. And we have a webinar for this, and I'll send the link to you. But also acknowledging that there is expertise in each continent. Africa is more used than us to deal with pandemics, and they have expertise there that we need to acknowledge and use. And we'll be hosting Q&As with people in Africa who has really a lot to say about this. When you look at Asia, because they are ahead of us regarding this pandemic, it's also maybe you'll look at solutions that now investigate recovery aspects of the crisis. And so you really need to adapt depending on also on where your continent is at what step of the pandemic you're into. But we're going to keep that aspect for the webinar. Thank you for asking. Lucy, do you want to introduce Solutions Journalism? You're mute.
Of course. Great. So, as the people from Solutions Journalism say, Solutions Journalism is actually not the right name the organization should have taken, because solutions is something that evokes, okay, well, problem solved, right? We don't have any problem anymore. But solutions journalism is more about reporting on responses to social problems. However, responses to social problems journalism network, that would be very bad for having a hashtag, right? So we take solutions as something that's not done yet, but it's rather a process. And solutions journalism is rigorous evidence-based reporting on those responses. We are interested in what is already happening in the world, not in the theories, and bringing stories, bearing witness of how those people are doing this. Basically, it's moving from the problem to the response to it. Of course, we all need to know about the problem first, right? So the traditional reporting about the COVID looks like this, probably. Most of the coverage, especially breaking news, are covering the problem, and that's completely okay, and we need to know what is the problem. However, the important point is that this is not the end. This is the middle of the journey. This is not the whole story, because the key question is, okay, so what comes next? And this is where solutions journalism starts. You ask with the same rigor the question about who is doing it better and who is doing it else differently. So over to you.
And yeah, I took that quote from Rasmus Kleis-Nielsen from the Reuters Institute. He was interviewed by journalism.co.uk last week, I think. And he mentioned that much of the public will be very soon sick of and tired of reading about coronavirus and all, because they'll feel like a lot of the material that is put in front of them is not material that helps them in their lives and makes them anxious, worried, and feel helpless. And he also suggested in that same interview that one way to prevent this is using solutions journalism in COVID-19 coverage. You know, how do you make sure that in the long run, people don't disengage from news just because it's too negative? And over to you. Yeah.
Thank you. So basically, solutions journalism is no rocket science. That's the good news. It's just good journalism, and you all know how to do it. Though we have a very simple checklist for you to help you to do it good, right, and high quality. So there are 4 criteria Solutions Journalism Network identified for you to have in mind when you are preparing your story. So the first criterion is that the story features not just a person, but a response to a problem and how it happened. And it's really important. This how is usually not covered in most of the stories. We only learn that something happens, but usually we don't know about how exactly, and we don't know really what to take from it. So existing response and how it works, how it happened, and how it's working.
And it's really frustrating when you read a story about a response, but you don't understand how it works. You kind of, you know, you're being really suspicious about this response just because you don't understand it.
Yeah. So number 2, I think general rule for any journalism, but most importantly for solution journalism, is you need to bring evidence of impact. You are not only covering wishes or good intentions. You need to be ready to prove that this is having an impact. This is also why you are reporting about it, right? Because you know that this is not only a dream, but it's actually working. So you need to look for evidence. Qualitative, ideally, stats are a really great help, but also quantitative, but also qualitative. So both of them are working. The thing is, you don't only cover a theory or an intention, but what's actually really happening. Anything to add here, Nina?
No, but I was wondering if there was any really important questions so far that we should take, Jeremy and Kai, maybe on this particular aspect. Since, you know, if you need to remember one thing about today is these 4 criteria. We are aware that the responses to COVID-19 are young and new, and so you might lack of evidence more than usual, and this is normal, and we recommend in that case to be really transparent about that. And I'm going to talk more about this with an example later during the training.
Yeah. So let's move to number 3 if
Okay.
there are no questions. No, I mean the 3rd criterion.
Oh, sorry.
No problem. So number 3 is The story seeks to provide insights. That's a tricky word for non-native speakers, but basically this is about the lessons that others can take from the story. Is there a replicable model, something that can actually help my community to get inspired and bring the knowledge from elsewhere? This is why you are doing the story, right? To help your community to move on with your problem. Because if it's just an one-off story, if it's a story of a miracle happening at the other part of, in the other part of the world, it doesn't really help you solving your problem at home, right? So the replicability of the approach you are actually picking is also very important to make an impact. And of course, you need to discuss limitations, because there is no perfect solution. There is no universal solution, and every solution has a limitation, a weak point, moments where it's not helping anymore, or people that are not covered by this approach. This also makes your story more trustworthy for several reasons, because if I read about a wonderful and perfect and genius approach, well, we are all kind of skeptical, aren't we? Journalists most of all. If I read a story and I don't see what's the catch, I will anyway believe, oh, there must be a catch. And I might assume, and maybe I will come up with a catch that's actually not real, and which is maybe worse than in reality. And also, if I'm someone who wants to replicate the approach, I should know what are the complications with it, what were the barriers, and how they overcame it. So limitations are also making sure that you are not turning into an advocate. Your role is not to promote the solution or the response. Your role is to bring information and bear witness, but you should still keep your distance. Although you might really be a fan of that approach, you need to keep distance. So, in English, there is a great acronym talking about the whole story, as we mentioned before. The whole story is only if you, after the A, say also the B, so what comes next. But the whole can also help us to remember what this solution journalism is about. So what is the response and how it works? It offers insight, it includes limitations, and it provides evidence of the impact. So that's the other way how to turn the 4 criteria. If there is only thing you should take away from this webinar, then it's those principles. Okay, over to you, Nina.
Thanks, Lucy. Yeah, so we decided to go through one story and highlight for you those 4 criteria, so it's more concrete for you. I'm gonna go. So it's a story I sent for those who registered before, I think yesterday 5 p.m. But we're gonna go through it. It's a story that was published by the New York Times, and I actually made a collection of 5 stories in our solution story tracker about this particular response, how Germany is doing to have a lower death rate than other countries, and especially in Europe. So we're going to just go through the story, and we'll send it to you later so you can have a deeper look and highlight for you those 4 qualities that Lucy mentioned.
Also in the chat, there is a link to this Google Doc, so you can actually open it right now as well, so you can have it after the webinar.
Great, thanks, Lucy. So the story starts by, highlighting one aspect of the response, and they call it corona taxis. Corona taxis in Germany are medical staff driving around checking on patients that stay at home, and they are looking at signs of steep decline after 5 to 6 days. And that's already an insight that is broad. So I'm going to mark where I am. that is brought by an expert, head of virology at University Hospital in Heidelberg. Sorry for my German pronunciation, who is acknowledging that there is a moment that when people start to be at risk in this sickness of deteriorating, and it's good to be able to react fastly. One limit that could have been explored in this article, but is just highlighted this way, is that corona taxis are only one initiative in one city. So I would say that if the response was in the long term, this could have been explored by the author as a limit, because when a response is not being replicated, that can be a sign of limitations. But since this crisis and this pandemic, everything is going so fast, maybe it's just a matter of time, and maybe it hasn't been replicated yet, but will be. Then we have a strong evidence here is that fatality rate in Germany is only 1.6%, compared with 12% in Italy, 10% in Spain, France or Britain, 4% in China, so they say, and nearly 3% in the United States. And this was published early April, so it might have changed since. Even South Korea, who was a model at flattening the curve, has a higher fatality rate of 1.8%. Then we have some insight of what the context in Germany was when the epidemic first started there, is that the average age of those infecting was lower in Germany than in many other countries, so people were younger. And this is because the epidemic in Germany started with people going to ski resorts in Austria and Italy, and they were relatively young and healthy. One possible limit, and I discussed this with Lucy yesterday, and I finally really understand deeply what she was explaining to me, is that thanks to massive testing, of course, you have a number of known cases that is higher than in other countries, but on paper, that automatically lowers the death rate. So this is really important to keep in mind while investigating the response from Germany, because you can play with the numbers and make them evidence when sometimes it's also a limit. But then the author is highlighting that there are several significant factors that play together in the German response, and testing is only one of them. So this is how the response on testing works, and then the author will be highlighting other aspects of the global response brought by Germany, is that early in mid-January, a test was developed in a hospital, and the formula of the test was posted online. So that allowed laboratories in February, so only a few weeks after, to build up a stock of tests. And that allows Germany to conduct 305,000 tests a week, and isolate known cases and provide treatment earlier than when you're not able to test people. An insight, so lesson learned about this response is that early diagnosis saves people's lives, because then you can provide the care they need. One other aspect of how the response works is that medical staff are regularly tested, and this is a really important point coming to how do you contain virus, and how you prevent from medical staff from infecting others. And an insight that is really important to note is that to work well, mass testing has to be free. If you're a young person with no health insurance, that's what a person from the story said, is that you're unlikely to go to the doctor and therefore risk infecting more people. Then the author looks at how the response works exactly and what measures are taken when someone is tested positive, which is really important to highlight. It's not sufficient to just test people, but then what do you do with the people that are tested positive? Testing and tracking is the strategy that was successfully put in place in South Korea, and Germany had tried to learn from that, which is actually what exactly Solutions Journalism wants to achieve. One thing that is also highlighted in this story is that Germany didn't do this right away. They learned from lessons of earlier failure when those people returning from ski resorts were actually not tested and not tracked, and that's something that has been understood really quickly in the country, and so they could change their strategy. So beyond testing, one thing that was put in place in Germany is that very quickly more beds were made available in hospitals, even if there were already lots of room. So I think, yeah, it's there. All across Germany, hospitals have expanded their intensive care capacities, and they started from a high level. In January, Germany had some 28,000 intensive care beds, equipped with ventilators, or 34 per 100,000 people. By comparison, that rate is 12 in Italy and 7 in the Netherlands. And that's it. That's a really important point, is that Germany decided to expand intensive care capacities, even though they were already satisfying. And they have almost 3 times more room than in Italy and almost 5 times more than in the Netherlands. One limit that is really important, and there was only really it could have been explored more also, is that when the article was written, so early April, experts were optimistic but could not guarantee that the system will allow to avoid triage among patients or either a measure to be taken. So they are still in Germany teaching, providing guidelines for doctors to know how to do this triage when the time comes, if the time comes, which we don't hope. And a last insight about, how Angela Merkel really communicated clearly, calmly, and explained why the restrictions and measures were taken. So the importance of a really clear communication from the people in power of what measures will be taken and how it's going to be applied. So I just want to say one last word, is that there is no perfect solutions journalism piece. You will never find a super 4 criteria solid piece. So sometimes it's weaker on the limits, which is the case for the article. Sometimes it's weaker on the evidence, which is not the case for the article, but which might be the case for most of the stories on solutions to COVID, because it's so new. And I think it's okay as long as you're being really honest with your audience by saying, we lack of evidence, or we couldn't explore the limits, or at least, you know, if you can explore the limits, at least you mention them. And this piece was also really strong on the insights, and since I know it's the criteria that seems harder to understand from the journalists, I really wanted to choose a piece that could illustrate well what we mean by that. And I'm gonna return to my presentation and give it to Lizzie.
Great. Maybe are there now burning questions to the story? Kai or Jeremy, did you notice something in the chat?
We have more general questions, but not particularly about the story. So when you get to them, we can give you a couple of those.
Great. Okay.
Good. So for now, we have hopefully explained clearly what is solutions journalism, but it also often helps to clearly define what it isn't. Stories that might look like solutions journalism because they are maybe covering a response, but are actually not solutions journalism in the way Solution Journalism Network defines it. And one of them is hero worship stories. Probably everyone knows it. It's the stories about people doing wonderful things, quitting their career and going to Africa, working with orphans, or as here, a woman donating hundreds of liters of breast milk. Definitely an interesting story. The catch with this type of stories is they are usually one-off and are a lot about the person itself, not about the actual activity. And they are usually not systemic, so the response is not really replicable at the systemic level. Instead, solutions journalism covers the methodology, the model, the approach. So, for instance, in case of breast milk, this story is about how a human milk bank is working and how it's helping and what impact it has. So human worship stories is not solutions journalism. Theories are also not solutions journalism, and it's one of the popular so-called imposter. Solution journalism is not about suggesting what should be done or what could be done or what might be the policy that needs to be put in place. It's about what's already existing in the world. So instead of looking for theories how to improve adolescents' well-being, it looks to stories how, for instance, drug abuse or teenagers drinking, smoking, and abusing drugs is a general trouble everywhere, I believe. But instead of suggesting what can be done about it, why not to look to Iceland, where they actually had a huge problem with teen drinking, and how Iceland managed within several years to really reduce the number of those cases. Although they didn't solve it at all, there are still teenagers drinking, but the rate has rapidly dropped. This is solution journalism. Magic bullet. Magic bullet is a miraculous solution. One thing that will solve it all. So this is a story that starts with the lead. Sometimes a soccer ball is more than just a ball. Sometimes it's a lifesaver. You feel the language, and you also know that, well, a ball is still a ball. And there must be something behind the ball, because the ball will not be the lifesaver. But what is it behind this, and how it starts and how it helps? That's actually the other story. And you tone down the rhetoric, and you don't only bet everything on the ball, but you explain the principle behind it. Related to COVID, there are also stories that might feel as a solution, but are yet not, about Netflix parties or volunteers who want to get tested or for the new vaccination, or online yoga classes, or many initiatives that are close and might seem to be solutions journalism, but are not yet. Why? Because we don't know much about their impact, and they could turn into solution story, but you need to investigate much more about how it actually influences the real world. Yeah, anything to add here?
No, that's good. Maybe we can take some questions now.
Yeah. So, Jeremy, Kai, over to you.
Okay, we had a few that were about evidence and responses. So maybe I'll just group two of those together to start. What if there aren't any significant data that supports the response? Is anecdotal evidence enough? And then many times there might not be consolidated evidence yet. So how to avoid looking like it's just a novel idea, not a solution?
Yeah, thank you, Jeremy. These are really two great questions. And I think as for the first one, we have seen good solution stories with only anecdotal evidence, as long as, well, again, you're being honest that you don't have enough data to rely on, but you still, could talk to some people that were impacted by the solutions, and they can testify that this is working or partly working or not working. So being really honest about it. And as for how do you, I understand the second question as how do you know if you can go for a solution story when the data is really weak, and maybe it's just a nice initiative. Correct me if I'm wrong.
I think that's what the question meant. Like, how do you avoid it looking just like a new idea without evidence yet behind it? Yeah.
So what helps? Well, first, trust this is a non-answer, but first your journalistic judgment. I mean, you're a journalist, you're probably critical, and you know when you're being fluffy or superficial, so just trust your judgment. But also, if you're not sure that this is just a new nice initiative, or it's a solid response, try to think in a bigger context. Is this at an individual level? Is it at a community level, or can this be replicated, or is it about systemic change, or just something nice happening somewhere? So when we have that, we recommend that people try to take a step back and think about, what lessons can we learn from this initiative? Is it helping moving the discourse about the problem forward, and how systemic can that be? Lucy, do you want to add something on this?
Yeah, I think you covered it.
Okay.
Well. Mm-hmm.
Okay.
We just had a follow-up that someone just posted related also to data. Many countries have had issues with data in the pandemic because testing isn't where it needs to be. What do we do if we don't have perfect or ideal data?
I would say you can use it, but you just being honest about it, and tell your audience that yourself is cautious and not suspicious, but that you need to take this data with caution.
Okay, and then we had just one final one in this round, unless my colleague Kai has any more. This one is, countries are very different in their responses to COVID-19. They might inspire you, but they are not replicable because Albania is not Germany, for example, or South Korea or Denmark. How do you find examples that work in your local context?
Yeah, so there are two aspects to that question, I guess. And Lucy, just jump in if you want. But so first, how do you look at responses that are relevant to your audience. You know, depending on the context, you might have some responses that seem to be working, but for your audience, it's not relevant, and maybe that's not worth investigating because it's a lot of time and resources for you. But you can also ask the question by saying, okay, this context is different, and I'm going to explain how this context is different. For example, I know in Germany, the way that laboratories work is that it's an open market, so anyone can sell these tests. In France, it's a lot more centralized. So basically, even if I investigate that response to a French audience, I would have to say, well, this is not possible right now because of, you know, the political context and the policy measures that are taken. But it's still worth investigating because it can put pressure on the decision makers. And even if the context is different, sometimes the context can change. So it's also your judgment to see what could be relevant, even if the context is different. And when the context is different, then just being really honest about it.
Yeah, I would only stress the fact that it's you who is picking the right story, and you are following your journalistic instinct. So you are judging whether this topic is relevant for your particular audience and country context. And the key question you are asking is, who is doing it better than us, where we can take lessons, and your aim is actually to bring it home to feed your public debate at home. So kind of removing excuses. We all know those statements by politicians or people in power. Yeah, we know this is a problem, but there is nothing we can do about it. By showing that the country next door is actually doing it, and showing that, well, they might have different context, they might have different system, but the principle of their approach is replicable and could be done even in Albania, is where you are actually moving the public debate on.
And I think you can also ask yourself, would it be just a feel-good story, which is probably not worth investigating, or is this response actually bringing some key information for my community to make the right decisions? And hi Mark, welcome. We're not done yet, but we're really excited that you're joining. So let's look at some of the examples we found in the European landscape. This is a story in Italian from Corriere della Sera, who is looking at why Greece seems to do better. And it's actually interesting because Athens imposed social distancing days before registering the first victim. And as of last week, there were 81 deaths and not even 2,000 people infected, which is, you know, in average in European countries, as for last week again, between 1,000 and 1,500 people were infected per million inhabitants. And in Greece, that rate is 163 people. So this article looks at what they did and how they did it. Lucy, Czech story.
Yeah, there's multiple elements you can cover COVID. You can actually approach the COVID situation. It's not only the medical aspect, it's also the social aspect. One of them were face masks. Face masks are completely missing in the market right now, and therefore it's hard for governments to recommend people to wear them because they can provide them. In the Czech Republic, there was a social response to this lack of material in a way that people started to sew their own masks. This is a report from weekly magazine Respect in the Czech Republic, and there is also an English translation at our Transitions website if you want to read it later on. And this is showing how it all started with few people sewing their masks, and then influencers jumping in and promoting wearing face masks because it's better than no protection, protecting the others. Not also, it doesn't work as a respirator, it works as a protection of the others. And it also shows how it actually turned into a kind of a movement. So everyone in the Czech Republic nowadays has a handmade, homemade face masks, which helped actually to cover the demand of the population for like domestic use when you are going to a shop or where you are traveling to work, so that you are not taking the professional masks from the medical staff, for instance. And the story actually tells how it all started, and also that it's not a perfect solution, but it's a solution for the situation we are having with its limitations.
And that's interesting because that probably answers one of the questions earlier, that, you know, this could have been shown as a nice initiative. I don't know, maybe 10 people sewing masks at home. It's nice, it feels good. People are, you know, showing some solidarity during this troubled time. This isn't, the story isn't about that. This is really about how a whole country started suing and how this kind of social change happened, and what did it do to influence the policymakers.
Also,
I'll try to
important
go.
element is that it's all about cultural norms as well. It was not a standard for Czechs to wear face masks, and within a few days we actually got used to it, and we really respect this. So everyone on the street is wearing it, although a few months ago we were just laughing about the Asian tourists, you know, like that was not the culture norm here. So this is about this systemic change in mind shift as well. Next story is about a solution for lack of respirators, because respirators are also in high demand. And 3D printing is a very good way how to supply quite in a very efficient way the parts that are missing. This story is about idea originally coming from Italy, where you can use the diving mask and combining it with a 3D printed ventile that you put on the diving mask, and then you can put a respirator on it, and you can have a respirator. And also the ventiles were helping in hospitals to run the ventilator machines. And it shows how it moved from like one-off initiative to institutions and companies joining and actually starting to producing it in big masses, because they also released the patents, you know, the protection of the copyright. So this is actually free, and every 3D company can print it and provide hospitals or facilities that are in need. So
I'm going to try to go faster because I see we only have 15 minutes left before passing it over to Mark. This story is from Le Monde, is looking at how some platforms, it's a program that is called COVIDum, basically follow up with patients that stay at home and allows to avoid to have too many people in emergency services. This story from Mediacity, who is a pure player, a local on local investigation in France, looks at what cities are doing to protect women victims from domestic violence. And this actually, these stories was the author is saying that he doesn't have enough evidence because it's all new. And he's just saying and being honest about it. And for a short story like this, he really did his best, I guess. And then I really like this story. Lucy, do you want to share about this story?
So this story is from the New York Times, bringing actually reacting to, okay, so people need to stay at home, and this is covering how Europe's safety net in terms of health insurance and security insurance and employees insurance and measures taken to protect people from having massive impact on their like personal economies is actually important part of minimizing the impact of the coronavirus crisis on people. And this is actually where New York Times is looking at Europe, how they are dealing with social impact and an economic impact on people, and what could the US take from it, covering how different countries are actually responding to it. It's not a universal approach, but there are principles that could help the US to minimize the impact as well.
I think we received a question by email yesterday asking, you know, what can you do a solution stories on recession? I mean, you cannot avoid an economic crisis, and it seems like many countries are entering recession. So how can you actually find an angle to it? You can, you know, investigate what countries are doing to help people, and looking at what is done for the most vulnerable, how to help people going through the crisis. So you can probably not avoid it, but you can look at solutions that are brought to people to go through it.
Also, to add, this article
yeah.
is not painting the reality pink. You know, it doesn't show that Europe has the best system ever and this is the paradise in the world. It is naming the limitations too. So it's really trustworthy then.
So often journalists are like, yeah, well, it's just good journalism, isn't it? Yeah, that's right. And I wish we wouldn't have to promote solution journalism or train anyone, because it would be, you know, one of the things that you can do when you're covering a topic. It makes journalism stronger because it's more complete. It gives a more accurate picture of the world and a more complete analysis of one topic. It can, as I was saying earlier, it can also increase pressure on the decision makers when you know one, especially on COVID-19, when you see one country that is doing better, or one initiative that is responding better to one specific problem, and you're covering it, just also tells the decision makers, where are we not doing this? Why are we not doing this? And it takes away excuses for inaction. It's also a good opportunity to investigate the problems that are right in front of us. And I know Mediacité in France asked their audience, you know, what is the most pressing for you right now? And do you want us to carry on covering coronavirus, or do you want us to do something else? And I think 1/3 responded that they want local investigation on the consequences of coronavirus locally. 1/3 say, oh, sick of COVID-19, give me something else. And another third said, we want to hear about solutions to this crisis. Really quickly, I want to say that if you're looking for inspiration, we have, as for this morning, 314 stories on responses to COVID-19 that are in our solution story checker, and I think 1/3 of them is from looking at international responses, and we have a taxonomy looking at how to contain the virus, how to care for people, how to cope with, you know, measures taken and the consequences, and then soon we'll have stories of recovery. I did 2 collections of solution stories about Europe. One is looking at, as I was saying, at how Germany is doing better. And this one is looking at how Europe copes with lockdown, and, you know, what initiatives are coming up, and also what systems in Europe are helping people to cope with the lockdown. if you want to submit any non-English stories about COVID-19 or other topics to our tracker that we are internationalizing, will be, I think, in a few days, our first collections of stories in French, German, Spanish, and also Korean, just because it made sense in this particular crisis. And then we'll give a few more tips on how to do solutions journalism, and we'll move to the Q&A with Mark. So key questions to have in mind for solution stories. Lucy.
Yeah, so it all starts with questions, right? So we already mentioned that the question you actually start your thinking about the problem is, who is doing it better? That's the very starting point. But you can also ask, how does the response work? And what metrics matter? How do you measure it, and how do you know it's working? Who is the response not working for? This is asking about the limitations, you know, like who is not covered by this approach. And what does the research say? Because research is a gold mine for data and also experts. Always ask the critical voice as well, because they can also navigate you to good limitations. You are always looking for constructive criticism, not for just a statement, yeah, this is a bullshit, but okay, why? Why is this not a good way to go? And maybe you will find out that the critical points are really valid. Has it been replicated elsewhere? This also gives you another piece of evidence that this is not a nonsense, that someone else is also doing it, and they might have modified it. So you can see another application of this approach, and this might be also useful for your story, because also we are all now looking to Korea or to Taiwan, how they deal with smart quarantine, but the single applications of smart quarantine will be very different in different countries, and we should look around to see what are the modifications of it, what are the lessons learned of how Germany did it, or Romania, or the Czech Republic, because we can all take lessons learned from the others. And definitely, what are the barriers to the replication, because we might not be able to take it one-to-one. And this is also not for looking for copy-paste solutions. You are looking for principles that could be applied and implemented in your context. But there might be barriers that will make it maybe impossible. So, or there might be barriers that can be removed. And if you don't address this, those barriers will never be removed.
And we'll send that to you, but one of the first things that the Solutions Journalism Network published as a response to support journalists' report on the crisis is our 24 questions to help you frame your solutions reporting on COVID-19. And, you know, it really goes back to the question, who is doing better? What works in helping women from escaping domestic violence? What works in supporting medical staff? What works, or who is doing better at containing the virus among elder? So this is really a starting point, and I'll send these 24 questions to you. And also regularly ask yourself, is there a possible solutions angle to this story? Maybe not. Maybe it's too soon. Maybe there will be a possible solutions angle to these stories that you haven't seen before. So it's a really two questions to keep in mind when you want to do solutions journalism. How to avoid advocacy?
Yeah, important point. You don't want to be an advocate. You want to be a journalist. Leave the advocacy to campaigners and civic society, activists and active people in the society. Your role is to bring the information and context and navigate people through it, who can then take action. To avoid advocacy, it's quite easy. Don't overclaim and don't use those judging words like genius, perfect, miraculous. Simply show the full picture, include the limitations and critical points. And basically, don't just go for the surface, but go into depth and show how it really works, so that people can understand it. Basically, and back to the 4 qualities, if you follow this checklist of the 4 criteria, this might help you to stay on a good track. So always ask whether you have covered at least somehow all of those 4. They don't need to be 100% perfect, but there should be always all of them somehow represented in your story.
Great. I think we can take questions right after I wanted to show this. We'll send this, but if you want to follow what we offer, what resources we offer, how many solution stories we have in the tracker, or what are the opportunities to get trained, you can register. It's free to the Solutions Journalism Network, and you'll have access to all our resources. And Lucy, do you want to introduce your?
This is our microsite for solutions journalism, especially people from Central and Eastern Europe. Watch this space, because we are publishing information also about open calls for stories here. So this is definitely an information page where we also cover now the current COVID situation and resources and stories.
And just so you know, we'll send out a follow-up email where we'll send the questions to frame your solutions journalism on COVID-19. We'll attach the link to how to do solutions journalism remotely. It's a 1-hour webinar also. There is a European Solutions Journalism Facebook group where you can share a call for pitches, you can share, the stories you're working out, ask for advices, look for grant opportunities, and it's really a collaborative group. So please come and ask your questions. We have 2 links to responses to the coronavirus crisis, and trying to connect journalists with story leads. So I know, Lucy, you have that for Eastern Europe, and we have that for international. Then we'll send the calls for pitches. I just saw that Positive News in England is looking for pitches on solutions journalism related to COVID-19. I know Our Europe is also looking for pitches. There is a list of newsrooms looking for solution stories that we'll send. The Solutions Journalism Exchange is a list of articles that you can republish for free, and you can also offer your articles to be republished. Grant opportunities, there are 3 big grant opportunities so far related to COVID-19, and then our newsletters. And I want to take time for questions for us, and then we'll welcome Mark. Jeremy, Kai, is there any questions we should pay attention to?
Yeah, there was one, actually there were 2 about the problem of trust in official figures and how to compare data across countries when they seem to vary so much. And I think one of our participants had a very good point, Ruona, when she said narrowing the focus can often help deal with the trust problem, because you can check data more easily in a small area than trying to, especially in a fast-moving story like this, than trying to compile data from an entire country and make sense of it. So narrowing the focus, I think, is often a way to get a more an angle that you can get a better grip on, both for solutions and every other kind of journalism.
Absolutely. I mean, I would have made the same answer, but I think for these kind of countries where you have to be cautious about the data that the government is providing. I mean, you have the same problem when not looking for solution stories, but regular stories. But the solutions journalism gives you this opportunity to narrow it down and look at smaller initiatives, and that's a good way to address that. Thank you for whoever said that.
We also had one posted in the Q&A section, just if you had any other tips about finding new story topics that had not been covered elsewhere. Because obviously, as the person says, I can imagine starting a story with a unique idea, but by the time it comes out, somebody else beat you to the punch. So curious about any other tips you might have about finding topics. And then just a final one here, if you could maybe mention how you do stories from home. I know SGN also did a webinar about that, and someone just posted the link in the chat, but maybe you could just mention how you do these kind of COVID stories from your home.
Yeah, so actually there was our community manager just published, I think yesterday, on our Instagram post with 7 tips to do solutions journalism from home, and they were really great. And I think the first advice is first plan your story as if you were traveling, but don't. Then rely on the people to capture images for you. So, you know, maybe even if you don't integrate them in the stories, just ask the people you're interviewing to make a small video so you can describe the surroundings and you know, make it more real. And this kind of really good tips. So it's on our Instagram, and yes, I'll send the link to the 1-hour webinar on how to do solutions journalism remotely. And the first question was what? I forgot.
Just any other tips about finding new ideas that others haven't done yet?
Yeah, so we'll also send, there are a few websites collecting responses. I know, for example, Outriders, the media organization based in Poland, is creating a kind of a radar for responses to COVID-19. I know Oxford, I think it's the university, is looking at how each government is responding. And I think depending on your audience, it's also good to rely on them and ask them, you know, have you heard about any solutions that we should be investigating? What works for you so far? What has worked for you? And if you're working for a local newsroom, for example, you know, the stories won't be the same. And so really engage with your audience, and that is a good way to hear about new stories. Thank you for bringing these questions. I think if Mark is there, we can, no, yeah. Lucy, you want to add something?
I noted one more question, which I find really, really good. And it's like, what's the limitations of solutions journalism? Because solutions journalism is also not perfect as any other solution, of course. In my opinion, it's the limitation of any quality journalism, because it takes time and energy and money. If you want to do a good story, you will not make it by copy pasting in 20 minutes or in 1 hour. It's not agency copying, it's true investigation. It's really investigation for change on what's working, not on what's not working, as in traditional investigative journalism, but in a way, the methods and the way how you approach the story is the same. It's investment, and you will get much higher outcome, much higher quality outcome, but this is also a decision of your strategy and sometimes of your bosses. So this is of course a limitation, because your editor or editor-in-chief needs to back you and give you time to go and dive deep into numbers, into research, into investigation. And I would like to stress that the research is key here, especially when we are now all locked at home. You need to spend much more time with research for solution stories, because you will save you a lot of work if you do it properly and if you do your homework. So that's in my view, the limitation.
Yeah, I think one other limitation, to be really honest with you, is that solutions journalism does not address the whole problem of too much negativity in the media. I mean, you can look for solution stories, and I had that discussion with some of the director at Le Monde, and you can have solution stories and at the same time having this daily counting of people dying, and this is really just killing us, and some people would disengage just because of that, even if you're doing solution stories. So that's one limit. It doesn't address the whole problem. It's a part of the problem.
And also, this is not about replacing the other journalism. It's really important to stress. We don't now push you to do only solutions journalism. It's only broadening or putting another tool into your toolkit. But you need to do the other stories too.
We'll move on to Mark. Mark, are you there?
I am here. Yes. Can you hear me?
Yes, perfectly.
Okay. I'm just going to. Do you want to see me?
Of course.
That would be lovely.
Okay. There I am.
Great. So I stopped sharing my screen. Mark, thank you so much for joining. I know you're busy because you're helping the newsroom covering other topics that you're not covering usually. Is that right? Or
yeah, it's been a very, very busy period.
Okay.
Yeah, as
well,
I'm sure
thank you.
Listeners can understand, but happy to be here.
Thank you. I hope it's going to give you some fresh air as well.
Sure.
So Mark, for those who don't know him, is running the website. He's the editor for the website, the Solutions Journalism column at The Guardian, and you're head of special projects at The Guardian also.
I am, yes. And I'm actually also now running our membership and supporters strand as well. So trying to do too many things, not very well.
And The Guardian already have 5 solutions journalism stories on COVID-19 in the solution story tracker. So
yay.
I think,
is that a good score?
I think it's pretty good given the fact that we started tracking them only a few weeks ago.
Well, look, yeah, that's great. I mean, I have to say, and this is probably one of the main things I wanted to say today, that I find it deeply paradoxical that it's taken the baddest, the grimmest, the worst, the most dreadful news story any of us have covered in our lifetime to really turbocharge solutions journalism. Because now, not just readers really want to get more solutions journalism to read, but editors across newsrooms all around the world. The penny has dropped. Editors finally get it. We have to have the good with the bad.
So you think there will be an after for journalism, thanks to the crisis?
Well, we'll have to see. I mean, I certainly think that as long as editors are having to put such grim stories on their front pages, then they're going to want something optimistic, something to leaven the mix, something to show the light at the end of the tunnel, inside on page 3 or page 7 or in the block underneath their lead story on their websites. The big question with all these transformations that we're seeing in COVID-19 is what is here to stay and what will simply revert back to how it was when we come through the other end. I personally think that looking at the traffic, looking at the reader response, that a lot more people now understand the purpose and the point of having solutions, constructive journalism in your mix. And I think that's a change that's here to stay. And I think that's obviously good news, if you'll pardon the pun.
We do. So it seems like more legitimate, both for editors and the audience, to do solutions journalism right now. Yeah,
and also for the journalists. We've got some guys I work with, colleagues in my newsroom, who've been a bit skeptical about this in years gone by, who suddenly find themselves writing about something that's going right and see that 500,000 people read that story and think, well, that's a good thing. I think I'll do that again.
All right. Lucy, do you want to maybe ask a question, and then we'll take the questions from the chat?
Sure. So, Mark, basically,
Hi, Lucy.
the question: is it easier to cover the problem or the solution in general, and also specifically on COVID-19?
I always think it's better to start with the problem. I get a lot of pitches from stringers, from freelancers on the solution, on a narrow aspect of the solution, an NGO that's doing good work here, or a community group that's I don't know, reinvented the pub or a cafe or something. And it always makes me think, well, what's the problem they're trying to fix? And is there someone out there who's doing it better or doing it differently? Why should I believe that this one initiative is the kind of magic bullet? So I much rather, it happens quite rarely that I get a pitch from a freelancer who says, I really think that, and let's just rewind pre-COVID-19, shall we? Someone who may have said before this current crisis, I think that air pollution is a really big problem, and I know that there are 5 cities that are doing some amazingly different things on air pollution. So they start with the problem, and then they reference perhaps why are some cities in southern India so much better at finding solutions than cities in northern India? Or they look at perhaps children in care and say that that's a big universal problem that many developed countries have. And then why is it that Denmark or Austria have such better outcomes? And I think that's a really key word here, the outcome. A lot of these stories, a lot of these ideas will start with data, where you can see a data point, an outcome that really is a big outlier. And then you start to ask, well, why is it? Why is it that women in Botswana only have 2 children per household, whereas in Uganda or Kenya or Niger, it's still 6 or 7? What is it that's different about Botswana? And that was one of our very first pieces, actually, that we investigated. So yeah, Lucy, a very short answer to your question is, let's start with the problem.
That's a really good point, and I think we also often recommend journalists to really define what exactly which slice of the problem the solution is trying to respond to, because if you're confused about exactly what you're trying to respond to, then you're not completely understanding the solution neither.
Of course, specifically with COVID-19, that's one hell of a problem. You don't need me to tell you that, but there are lots of different strands. And again, I think that we've seen a lot of really great journalism on this. So to begin with, it was, if the problem was infection, why was it that Taiwan and South Korea were so much better than China or Iran in those early days? And then when it came to critical care, why is it that Germany had so many fewer deaths? Was that down to their testing, or was that down to the number of beds and ICU units and ventilators that they had? And now, as we've come sort of further deeper into this problem, why is it that countries, small countries, admittedly, like Faroe Islands or Greenland, have no cases at all, have eradicated this problem? What did they do? And all those, I think, are ideas that start with data points. We just simply looked at, in the early days, and saw Taiwan's numbers and thought, well, that's extraordinary. That's an outlier. We need to know why. And if we find out why, I liked what you said earlier, Julia. If we find out why, then we can pressure our own governments, who, let's face it, are having a tough time dealing with this. And we can say, well, you say it's difficult to roll out enough tests, but Taiwan did it. Or you say it's hard getting hold of the ventilators, but Germany managed. So you start to use the solution to put pressure back on the authorities to raise their game. And that's where you're really creating a virtuous circle.
Yeah, that's what we call, when looking at data, to find like what we call the positive deviant, which is right. You're not used to do that. But
I think I'm a positive deviant, definitely.
You are. Okay, so what are the questions from the journalists, Jeremy and Kai, please?
Yeah, so hi, Mark. Good to see you
Hi,
again,
Jeremy. How are you?
even in this context. Yeah.
Mm.
So we've got a bunch of questions for you to start off with. One here was, are you also relying on your members or readers in some way for tips? The exact question is, how can membership programs or strands, as you call it, help in reporting on COVID or other stories? Do you listen to tips and ideas from them? Is it a two-way street right now, or do you report back to them mostly?
Yeah, you do get a lot of tips, and I mean we have about 1 million supporters, members now. We need another 1 million, so if you've got a bit of spare cash out there, then do join us. But I think you have to be proactively engaged in that as a conversation. So you can't. I don't think you can just sit there and wait for members to come up with all kinds of great stuff. I write to them once a week in a newsletter, and I normally try and have a couple of teasing questions in there. Sort of, what are you doing? What are you seeing? What's it like where you are? What works? Not every week, but some weeks. And I do the same with an Upside newsletter, which goes to readers on a Friday. Do sign up if you haven't already. So I think what I'm saying is that, yeah, we get a lot of tips, actually, both in terms of solutions, but also some good story tips from members. But they kind of need to be primed and encouraged. You sort of need to pose the question and to give an easy way for them to click, and for the email box to open up, and they can sort of fire their point back at you. And, you know, a lot of it you'll read and think, well, interesting, but not quite a story. But then occasionally, you know, I'm trying to think of a good example. I mean, in the Upside Weekly, we've had some fantastic input from readers, mostly along the lines of what are communities and neighborhoods doing to sort of keep each other going. So not necessarily as a solution to kill this virus stone dead, but as a solution to help people cope with this long period of quarantine that we're living through. And some of that stuff, that a woman last week sent me a great video from West London of a very big block of flats, and an individual in the grass patch in front of it doing a Zumba class, and everyone was on their balconies joining in. And it's stuff like that you get, but you do have to ask for it. You do have to be quite actively soliciting and inviting people to contribute, and then you can't stop them.
Okay, we also had another question from Martina. What kind of experience have you had with possible treatment or vaccine coverage?
Yeah, this is hard because so you get a lot of stuff through the journals, you know, and that's how we tend to do the treatment vaccine stuff very much through our science team, because they're all PhDs, they're scientists who are journalists. So I've rejected a lot of pitches from freelancers saying, I've heard about this great new vaccine initiative in such and such, can I write about it for you? And I tend to say no, because I want my scientists to verify and to look at everything that's going on. And there's dozens and dozens of vaccine initiatives out there. And I want them to evaluate which are the most plausible and which are the ones that we should be writing about. Because at the end of the day, we really need our product we need it to be optimistic, but we also need it to be reliable and responsible, and to be not picking up on things that might work but things that probably will work. So, I mean, that's been the approach on vaccines. On testing hasn't really been a solution story. I totally agree with both Julia and Lucy when they say not everything is a solution story. Yes, if you've got the reagents and the materials, you can roll out a very big testing program and it can be part of the solution. But most countries are a long way from that, or at least the UK, US have had really hard time with that. So for us, the testing piece here has been much more of a kind of, we haven't really got through to the solutions end of it yet.
Any other questions?
Yes, we have one. We have one from Russia. Who says everyone understands the importance of quarantine measures, but in Russia it is inseparable from police lawlessness and arbitrariness. How to talk about this using solutions journalism?
It's a really good question. I think this is something that we've missed, or that we've only really hinted at in our coverage, which is how lockdown has been different in different parts of the world. And we focus very much on, actually we focus a lot on the solutions end of things in Western Europe, you know, the spirit, the neighborliness, the way, you know, the Italians have played violins on their balcony, and the French have done sort of cycling marathons in their garages for charity. But we haven't really investigated abuse that perhaps might be happening in Hungary or Russia or further places like that. I'm stumped. I'd love to know if the questioner has any ideas. I have lived in Russia for quite a long time when I was a younger man, and it was a much freer period. But I do know that feeling of feeling that you're not only ranged up against a virus, but you might be ranged up against the authorities as well. It's tricky.
It is tricky. I lived in Russia as well for 5 years, and I think one way to look for solutions in Russia is more at a county or state level, because I know some states can, you know, apply some measures that other are not, and also really looking at what the citizens are doing and how they are organizing themselves when the government is not.
I guess that's right. I guess that's the approach, isn't it? If you find a region or a governor who's doing things differently and producing better outcomes, then, you know, write as much as possible about that, sort of pour encourager les autres, as you say, Julia, I think.
You keep calling me Julia, but I'm using Julia's account. I'm still Nina, though.
If I could add, maybe also another way to look at that question could be to look at an African country which has similar levels of police corruption that's been dealing with in the past, an outbreak, and how they did that even with a corrupt police force. That might be a way to look at it from a solutions angle, potentially. Mark, we just had one other general question for you, which was how are Guardian editors also able to devote time and attention to non-COVID stories right now?
It's really difficult. There's, I think, about 70% of our content that we're publishing is on COVID-19, which is unprecedented. And we're not doing that just because it's interesting. We're doing that because that's what readers are reading. I've been editing the newspaper for the last couple of weeks and trying to find material that is unrelated to COVID-19 is really hard for a number of reasons. But most of normal life is suspended. There's no business, there's no politics, there's no sport, there's no culture, really. I mean, of course, there are little bits around the fringes, so those stories aren't really there. Every journalist wants to be in the COVID-19 space, so few of them are hunting down stories elsewhere. But what I would say is that we do need this stuff. We will get to a point where we move on from this. And I think that, I mean, it's really hard to do, but if I was a smart freelancer out there looking to land a solution story to major newspaper, I wouldn't be focusing on COVID-19. I really wouldn't. I'd be looking far, far away from it, as far away as possible, because every newsroom has its COVID-19 team, and they're huge. All the resources are there. They're hunting down every angle. We're producing, normally we do 2 or 3 upside pieces a week. We're doing 2 or 3 a day now, and that's our own staff who are doing that. So yeah, my recommendation would be unless you've got something really absolutely unique and original that nobody else has got, which of course you're going to want to sell to a big outlet and get, you know, 1 million people reading it, then I'd be trying to sort of look at stories away from this space. I know it's really hard, but that would be my advice.
Have you found that people are tired of reading all the COVID stories all the time and looking for other topics, or do those stories have little play these days?
Well, it's a difficult. There's a two-pronged answer to that question. There are a lot of people who are cutting back, who don't want to read it, who understand that it might be not great for your mental health to be reading 1,000 stories about death and destruction every day. So anecdotally, yes, we're hearing that people say, you know, please give us something else. But the data says not. The data says, you know, the traffic, the amount of readers, the number of readers, you know, in March alone, we had 366 million unique browsers to the Guardian website. Now that's not an individual, but that's still hundreds of millions of people. It's unprecedented, and they're all coming for this one story.
Yeah. We had one very good question that just came in. COVID-19 has highlighted the different responses by national governments, which makes sense, but is also definitely encouraging nationalist navel-gazing. How important is the transnational approach within solutions journalism, and particularly at The Guardian, or are 99% of the stories about the UK? What about best practice sharing across borders?
Oh no, we're doing, I mean, I think that, well, again, several prongs to that answer. I think that the international community was pretty slow on this story. The G7, the EU, took a long time for them to sort of build up their position and figure out where they fitted into this, because although these crises are universal and happening everywhere, they're very much national crises. They're being seen that way. Each country is kind of fighting it almost on its own, with its own, using its own financial firepower to try and keep the economy alive just as long as this carries on. But that said, I do think that some of the best solutions pieces we're reading in this space is, as I mentioned earlier, if Germany can do X, why can't Britain? If France's numbers are like this, why are America's so much worse? What are the things that countries are doing that can be replicated, that have evidence of success, that can be replicated elsewhere? You know, and so that's where you want to see EU and G20 taking more of a kind of voluble and active role in kind of spreading best practice and in issuing guidance and in trying to unify this response, rather than have everybody make the same mistake in every jurisdiction before we finally realize and figure out what works.
Maybe we can take one last question, and then I think it's time for all of us to go lunch. Is it too early for you, Mark?
It's not time for lunch. I've got to go to another meeting in 5 minutes. But,
okay, so very last question.
We didn't have any others related to journalism, but there's one here that maybe you could answer nevertheless. Do you think that COVID can help to show the great inequality in society, how minorities like the aroma without running water are on a higher risk? Can we show how those more equal societies will handle the pandemic better?
That's one for a political scientist more, isn't it? I may have a view on this. It's my own personal view. I do think that we learn a lot from this pandemic, and I think a lot of it will end up improving the way that we see our societies, the way that we see injustice, the way that we strive for social justice. I think these are issues that are suddenly very much to the fore. I don't know much. Did you say did you reference the Roma community, Jeremy?
No. It wasn't mentioned.
Right. I think that a lot of good is coming out. I've never felt so sort of positive about humankind at the same time as feeling so worried about, you know, our sort of physical health and our economy. I do think it depends how long this goes on for. I think if it at the moment, there's still a kind of, we're in this together, there's still a kind of a bond, a spirited response in the UK, and from what I read about responses in France and in Italy and in Spain and other countries. But I worry that if it does go on for too long, then I think sort of that social cohesion might be replaced by more of a sort of divisive thing, as people really end up, struggling. And we have to get this balance right between saving our health services and saving our economies, because our economies can probably hold their breath for 3 months, but after 3 months, I don't think so.
Yeah, sorry about that. It was a reference to the Roma. I didn't realize there was a typo there, but that was partly the question.
I know that's a very live issue in Central and Eastern Europe. I just don't feel qualified to comment on it. I just don't know enough about sort of deprivation and minority groups in Central Europe, I'm afraid.
Thank you so much, Mark. As always, it was wonderful to have you. And
thanks, Nina. Sorry about teasing you about your name.
No, that was funny. No, I'm done. Good luck for you, all the work, and carry on the good work.
Good luck to you. Let's do this again sometime.
Thank you, Mark.
Okay,
thanks.
Cheers, Lucy. Cheers, Jeremy. Bye, Kai.
Bye.
Thanks.
So, might maybe turn back to our panel now. If you have any burning question, I think we can maybe take one or two to conclude. What do you think, Nina?
Sure. I mean, you might hear my kids that are back from a little walk, but that's fine.
So guys, if you have anything burning for now, just type it to the chat. Otherwise, we would release you back to your realities, home office realities. Kai, Jeremy, anything in the chat?
Yeah, I would be very interested to see people doing more writing, reporting on transnational initiatives or cooperation, because there doesn't seem to be much of it. I mean, the EU has disappeared. It's sunk almost completely out of sight. And even though I know the Commission has some programs in hand, no one's reporting it. What's happened to the European idea? I don't know how solutions journalism can be applied to this, but this really concerns me, actually.
Yeah, that also concerns me. I guess it's more a comment than a question, but that would be great to encourage this kind of coverage. I completely agree, especially given the European, context and all the countries that are responding differently. And I just saw one quick question in the chat. We will share the presentation with you, and we'll make sure that the links to the stories we used are there, so you can use it.
Good.
Maybe one final question for both of you, and I know you might have mentioned this before, but just to talk about the definition of a solution in these times as people are going out to cover various responses.
A solution is a response that works or seems to be working.
Yeah.
I'd say, but we also can learn from a failure. So even if a failure is not a solution, obviously, solutions journalism allows you to report on the failure as long as you can learn a lesson from it.
Yeah,
I would
only
say.
stress this. Actually, there is a great solutions piece on lessons learned from Italy. So despite the fact that Italy is the most impacted country in Europe, there are valuable lessons the other countries across the world can take. So even from the place that looks really bad at the moment, there are things that can be actually taken away. And yeah, don't forget that the solution is not a final thing. It's a process. And be clear that you are reporting about what's happening right now. You have evidence for what's happening right now, right here, and you bear witness about that. But you shouldn't claim that this is an ultimate solution. This can turn into a problem, like plastics, for instance. Yeah, it was part of a solution, and it's a really important thing, but it also turns to become a problem. So you need to be clear that you are only referring to this very moment where you have available data.
Yes, that's a really good point, Lucy. Thank you.
Good. And I think this is for now, right?
Yeah, thank you all for joining. And we'll share what we said, and we also carry on posting resources and tips and good stories in our European Facebook group. So please join if you're not in.
Yeah, feel free to sign up to our newsletters, and we will keep spamming you.
Yeah. Thank you all, and bon appetit for those who will go for lunch.
Thank you. Have a nice day.
Thank you, Jeremy and Kai, for doing this.
Yes.
It's been fun.
You were great.
Have a nice day, guys.
Bye.
Thanks. Bye.
Stay safe.